Hi, I'm Dr. Rand. How you doing today?
I'm doing well. My name's Roy.
Roy, nice to meet you. We're going to be examining your spine today, which is basically the base of your head. It's about your belt line. If I need to expose any skin in that area, is that going to be okay?
That's great.
Okay. Can I actually have you take your shirt off for evaluation? Check the table for support. And then go ahead and have a seat and face that wall, please. Alright. The general scan. And we'll do that credit control wiper down to the PSISs. And check the SI joints. Check the springiness in it. In this general scan, I felt a little restriction in the mid-thoracic area, so we'll further evaluate that. As of now, though, can I have you lay down on your stomach? And we're going to check the right SI joint. Oops, this side. The PSIS, and place my superior hand just medial to the PSI, falling into the joint line. Inferior hand to the ASIS, and do A to P. And this feels like a healthy joint with the ilium moving relative to the sacrum. And that was flexion. And to do extension, I'll come also to the PSIS, just medially to that in the joint with my fingers. And extend the SI joint this way. And it feels healthy and normal as well. Okay. Alright, Roy, if I can have you sit up and face the wall again. Thank you. We're going to evaluate the L2, L3 segment. I'll find the iliac crest, bisect medially. That should take me to L4. And palpate two spinous processes superiorly. And then that should put me at L2 and go one interspinous space inferiorly, L2, L3 junction. And to test for flexion, I will flex the patient forward, bring him back, and I feel the joints opening, so that's normal, it feels good. And then to check for rotation, patient, can you go ahead and cross your arms? Go ahead and rotate to the left. Oh, with my thumb. The same junction, but just lateral to the spinous process. That feels normal as well. And then to rotate to the right, that feels normal too, and pressing in also to feel the in play, pushing lateral to medial. And then also, you need to check lateral bending. So L4, L3, L2, L3 segment, L2, 3 segment. I'll go ahead and laterally bend the patient to the right. And I and feel the joints moving relative to each other, so there's no restrictions. Let me go ahead and test the left side. Laterally bend, and those feel healthy as well. Okay. Lastly, well, second to last, we'll go ahead, you can uncross your arms. We're going to test the T8 and T9 segments. So I'll come here and find the inferior scaps. Bisect medially. That's to the T7. Okay. And come 2 interspinous spaces inferiorly, and just go up 1 interspinous to put me at T8, T9. And then I'll flex the patient forward. And it feels like there is some resistance. It doesn't open like it should in a healthy joint. And I'll ask the patient, go ahead and then cross your arms. Thanks, Roy. And we're going to check for rotation by putting the thumb just lateral to the spinous. And check left rotation. And it opens up just nice. And come to the right. Check the right. And there is a difference with the right from the left. It doesn't open up. So there's a restriction to the right. So right now we have a PR. So now we need to check lateral bending to see if it's a PRS or a PRI. So and that opens up. So that's normal. But let's check the left side. And there is some restriction on the left side, with the restriction on the right, rotation, restriction on left lateral bending. That should be a PRI. Okay, and lastly, we're going to check the ribs just to see if that's causing the problem. So come back to inferior scaps, dissect medially to T7. And go 1 spinous inferior to come to the T8. And now to get to the ribs, we have to go up 2 interspinous spaces and out laterally 1 inch and out laterally another inch to get to the ribs. And Roy, can you go ahead and cross your arms one last time? Thank you. And so for depression of the ribs, we'll rotate the patient, laterally bend and extend while pushing S to I. Oop. And that feels normal. But to get to the other rib, just to check it, we are laterally 1 inch and another inch, so out laterally 2 inches. Going to rotate, laterally bend and extend slightly, pushing S to I for depression. And then for elevation, we're going to be pushing I to S. We need to rotate, flex, and laterally bend. And that's normal. Thank you.